Okay, so I'm trying to upload I've uploaded the video. I'm trying to watch the video. Oh, okay, there it is. Today is... hold on.
The first step.
Okay, June 23rd, 2020. That's raspberries today.
The amendments we have tabled today.
Can you see?
Strata Property Act
And I did this 2 days ago? Right, that's what I'm saying. And then I'm going to use these. They're not that sour. They're really not. And then I've got a bit of rhubarb yet. So I'm going to start cooking up these ones first. Doing the same thing, people. Okay, so 5.2 million people in the province of British Columbia, Canada. Last check was like 2 days ago, right? They had 169 deaths, with the majority of them, 70% and more, are directly related to old folks' homes, with half of those old folks' homes privatized, owned by Chinese investors that have a suspicious past, right? Because they cut a deal with the federal government, and then they just came into BC and started buying up all the public healthcare old folks' homes, right? And anyway, this woman is now saying, you know what woman that is, right? She's now saying, we're in an epidemic. It's an epidemic. 169 people out of 5.2 million people. It's an epidemic. Please, people, get underneath. It's a disaster. It's a disaster. Go underneath your door frame and stand there and wait for the earthquake to shake it. As she pushes until we have an effective treatment, she doesn't talk about anything that anybody has said anywhere, right? Or the big vaccine.
We all know what we must.
Oh my God. Anyway, you can see what I've done. So I got, this is all is same, right? Apple and raspberry. I used the green apples that I had with that raspberry I had, right? So that's really good. And here's the oranges. I've got them ready now to run them through, sorry, wandering eye, to run them through that little machine, right, for Amari. And then, of course, I will just freeze those.
Individuals, we also have an important role to play in ability is to keep our bubbles small. Know the people that we are with, that we have those
because it's an epidemic
over time with. This gives public health teams the ability.
They're not letting nobody go in and see these old people.
Contain the spread as quickly as possible.
Can you believe that?
So this approach applies to
That's
all
what
of
they
us,
were
no
doing with
matter
Uncle
where
John.
we be, whether it's at
You
home,
can't
work,
see the
community.
kids.
We're traveling
You
to other
can't
parts
see
of
the kids. You're not well, John. I have it on fucking video, people. You can't see the kids. You know that. You're not well yet, John. Hey, that was in 2015, people, and they got away with it. And now they're doing it to hundreds of old people. Now they're doing it to hundreds of old people. They're not just doing it to Uncle John. They're doing it to hundreds of old people. And just as fast as they're dying in their care homes, they're kidnapping them from the hospitals and filling up those beds with fresh money. Okay, so I grinded it up, right, before I actually, it looks like I should have done it a bit more. I missed one right here, you can see. It didn't make it. Actually, there's a couple of them in here. No, it's okay. I have to do this again. Okay, I'm going to end it on this. I'm going to keep this one real short, people. So anyway, leave a little bit of a headspace, right, because there's liquid in it, so it's going to rise. Preferably don't put a lid on it. So I'm debating whether I should just put that lid on there. It's just an old lid. Just very loose with that.
Oh, hi, Dr. Henry.
Right?
Just based on Twitter,
see, you don't even screw it on. And then after it's frozen, then you screw it on. Other than that, it might expand too much. Right? So you don't want to crack your jar. So there you go. That's enough for 2 times for Amari. And then here's a little bit left over. I still have that. And then, of course, we've got that. So for every penny that I spent on these oranges, I pretty much got my dollar's worth.
Rampaging through Washington State. Do you have a concern how that could affect potentially the timing of phase 3 or just start the next step that we're about to take?
Yeah, it's very concerning.
I was
watching
just
what's
on a
going
live
in
stream.
Washington. I know they've been
That
doing
was,
some really great work there in terms of the public
like
health
a committee
work, and
board,
they were
like
able
a
to
mayor and that type of
locate.
thing, right?
They have a couple of
For
quite large
county.
outbreaks in processing plants and things.
And,
I don't see it as affecting
they
us.
were
We
discussing
do know that we have people,
whether they should make
particularly
masks
truckers who are going back and
mandatory
forth
or
with essential
not.
goods across the border.
And apparently,
But we have had that for some
this
time.
guy
and there
just
is a
at-
process
just
that they need
stated
to follow to
that it just
self-monitor.
happened.
We know that there's fall in particular.
Hold
that
on,
will
I'm
have
gonna
that as
find. Okay, so prior to this question should be coming up after this. Okay, but she was talking about they want to start testing wastewater, right, from the districts, and of course they're going to start small. This is a bunch of hogwash again, people. Do you know that in Victoria, British Columbia, Canada, they take their sewage, their raw sewage, and they flush it out to sea. They don't even process it, okay? I grew up on the island when I was a kid, right? Right? And I played along the ocean and the waterfront for years out there on the rocks with the crabs and the bullfrogs and, the clams and the whole 9 yards, okay? And it wasn't polluted. I left, people, okay, whatever. I came back 15, 20 years later. I'm telling you, their beaches are so polluted. It's pathetic. So before they start testing water to see if it's got COVID-19 in it, because somebody pooped in a toilet, I think they should be investing that money into cleaning up the freaking, up by Oak Bay, wherever this water, well, it's through it's through Dallas, it's through Oak Bay. All the beaches are like putrid because of this shit washing up back onto shore after they flushed it out, okay? The water doesn't completely get rid of shit. All it does is move it around, spread it around, and then it washes up on the shore. It attaches itself to all the shells and the rocks, and it's gross. I'm thinking they want to start bringing in these little testing water sites in these isolated communities so they can isolate what the people are doing. Not that they have COVID-19, but they want to see how many antibiotics are going into the water. They want to see what kind of drugs are going into the water, because if you take a lot of antibiotics, what happens? You urinate it out, right? It goes into the water, into the toilet, and then it gets into our water supply, people. Okay, I just wanted to say that. I think before they go off start testing water for COVID-19, I think they should take that money and clean up their freaking beaches in Victoria. It's disgusting. You can't imagine how disgusting it is.
One more question today. For any reporters that didn't get to ask a question, there will be a statement released later this afternoon. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Keith Baldry, Global News.
Hi, Dr. Henry. Thanks very much for taking my question. I want to talk about the United States again. Just within the last hour, Washington State
Within the last hour,
Governor Jay Inslee has ordered a mandatory...
Governor Jake Mansley in Washington. Sorry, it's not in Florida yet. It will be in Florida tomorrow. Because this is an orchestrated effort. Okay? I just sat here off and on throughout the day listening to a board of, a committee board of some sort for a county, voting in mandatory masks in Florida, right? I don't think the governor was involved with that yet, but it's going in front of the governor, okay? This is an orchestrated attack on the population of the USA Canada, Mexico, and so on, and so on, and so on.
Rule for wearing masks in public statewide. It had been enacted, but it's now statewide. I know
Now it's statewide.
your position on mandatory masks. I'm not asking about that, but given what's happening in Washington State right now, and we do have people crossing the border back and forth who are essential service workers, but may contract the virus that seems to be rampaging through Washington State. Do you have a concern how that could affect potentially the timing of phase 3 or just start the next step that we're about to take?
Yeah, it's very concerning watching what's going on in Washington. I know they've been doing some really great work there in terms of the public health work, and they are able to locate, they have a couple of quite large outbreaks in processing plants and things. I don't see it as affecting us. We do know that we have people, particularly truckers, who are going back and forth with essential goods across the border, but we have had that for some time, and there is a process that they need to follow to self-monitor. We know that there's measures being taken both when they're in the States
Yeah,
and when
be good boys.
they come back to make sure that people aren't transmitting.
Don't rock the truck. If you want to keep your job, right? Button your hole.
And that they're taking the measures to
So they got all these trucks going back and forth, but the fentanyl dried up in British Columbia, Canada. Okay.
have safe.
No, it has something to do with the NDP trying to promote their SAFER program, which is a offshoot of methadone and something else that, they're funneling money into, right, to give to the addicts, right, to supposedly help them as they're evicting them from those modules, right?
Physical distancing and things when they're in the U.S. So they
blaming COVID-19 for the rise in fentanyl deaths.
are getting used to it, as we all are learning about how to do that safely. And we have had people who have returned from trucking and others from the U.S. who've had symptoms, who've been tested and have not passed it on to others. So we need to continue to be sure to monitor carefully and to make sure people get tested routinely as needed.
This is going to go on for years, people. Okay, hold on.